Alright, this video is going to cover the medical emergency of a prolapsed umbilical cord. As you can see in this photo, a prolapsed umbilical cord is when the umbilical cord comes between the head of the baby and some surface of the mother. Sometimes it prolapses out of the vagina where you can see the actual cord, and sometimes the prolapse is occult, meaning it's hidden inside the uterus somewhere. Either way, the compression of the head of the baby onto the umbilical cord cuts off the supply of oxygen to the fetus, making this a life-threatening medical emergency. There are a few do's and don'ts of this medical emergency that you need to be familiar with for the NCLEX. First and foremost, you need to know to stay with your patient and call for help. This is not something you can take care of on your own. After you've called for help, insert a gloved finger into the patient's vagina and lift the presenting part of the fetus, be it the head or the buttocks or the feet, off of the umbilical cord. This should relieve the compression that is cutting off oxygen to the fetus, and you should be able to palpate a pulse in the umbilical cord again. You'll have to keep your hand there until the baby is delivered, because if you let go, that part of their head will go back onto the umbilical cord, cut off oxygen, and the fetus could die. After you've lifted the presenting part of the fetus off the umbilical cord, put the patient in a position where their hips are elevated above their head. That way, gravity helps you keep the presenting part of the fetus off the umbilical cord. Most commonly, this will be knees to chest or Trendelenburg. You'll also want to administer oxygen and prepare for immediate delivery of the fetus. The NCLEX also might trick you into asking what you don't want to do with a prolapsed cord. The three main things to know are never ever leave the patient, do not attempt to push the cord back inside of the woman, and do not take your hand off the presenting part of the fetus. By attempting to push the cord back inside the vagina, you'll lose visualization of the cord and be unable to lift the presenting part off of it, therefore restoring oxygen. And taking your hand off the presenting part of the fetus would also cut off oxygen supply, which could be detrimental to the baby. Those are the big things you need to know for the medical emergency prolapsed umbilical cord.